Hello, my name's Dr. Paul Lederer, and today I'm here to talk to you about vision in children with special needs. Now, when we talk about children with special needs, they can go from the array of children that have developmental delays to children that have sensory overload issues to child that's been diagnosed with a behavioral disorder or anxiety disorder that seems to be related to visually demanding tasks or attention deficits, or even children that have autism where vision is such an integral part of often what they have to deal with in order to function, to learn. So when we look at these children, we see that these children are higher at risk. We classically can see a higher percentage of these children with visual disorders that interfere with their performance. Visual disorders, visual conditions, well, perhaps we're looking at something so simple as their inability to track a target well without gross motor body head movement, or perhaps their ability to not understand where they are in space perceptually and where they are in relationship to objects, either because of a processing issue or because their eye teaming is inefficient and they can't use the two eyes to judge where things are and where things are in relationship to them. Visual processing issues, finding the figure from the background, visual difficulties of using imagery for visual memory, the kind of things that relate to how you interpret what you look at in space and what's the world you see and how does that create meaning and how do you act upon that through motoric movement. These are the kinds of visual issues that need to be looked at and addressed. We need to go beyond just checking that they have healthy eyes and that any need for glasses is addressed. These things go well beyond those issues. And why are they important? Because they give us leverage on performance, behavior, attention, opening up a world of learning to a child who would otherwise either be avoiding it or unable to exist in that world to kind of interact with the world they see. Children that visually are so focal in their attention gates that they're not aware of their periphery, or children that become so aware of their periphery that they are not aware focally, and the way in which to bridge this simultaneous processing and awareness of how to exist in the world, to see movement and to not have it overload you around you, or to be able to process information because you're not so busy just trying to keep your eyes in place that you can't concentrate on what you're doing. These are the kinds of things that are presented to children very early that create their developmental issues that often interact with their other developmental problems that they face. So vision is an important tool to address, and one of the most important things, again, that I see that I feel so passionate about is when a child who may not be at the stage where they can read is looked at as if, why should they need these glasses, for example? They're not reading. Sometimes not understanding that a child's world is important to them as a doctor's world is to them, as my world is to me, as your world is to you. That the way in which vision interferes with their performance is an important area that needs not be neglected. And so too, the very glasses that didn't help this child read better made a huge difference in reducing fatigue, improving their situation by the end of the day with less fatigue and stress, performance improved, attention changed, and willingness to do things that they otherwise would have avoided. So I hope this gives you some further insight into understanding how vision relates to performance and behavior in children with special needs, and that children that are more at risk should be evaluated properly. And when evaluation shows a condition that exists, they should be addressed, and intervention should be appropriately done in a way that's very specific to that patient and to their needs. Hello, my name is Dr. Paul Lederer, and today I'd like to discuss vision in infants. Such an interesting subject. The fact that we can now evaluate a baby at any age and measure their sight both behaviorally and electrophysiologically and in a very objective, non-invasive way is amazing tools that are now available to evaluate children that do not have to talk to me to get a significant understanding of what their sight is or what their prescription is in terms of glass needs, or if they have an eye that turns, or if there's a tendency to have limitations of eye movement function. These are things we need to know early. Infant development is so dependent on vision. Vision guides motor movement through space. It leads the awareness of depth perception, which develops very rapidly in early months of development. And those things of knocking off the toys off their chairs is something that experiences of depth perception parallel the development of those systems in the neural system of the brain. So I think it's extremely important that these perceptual development things occur, that they enjoy the fact that they have normal visual systems upon which to guide this development. However, there are many children who are not discovered as having certain conditions at infancy that I only see when they're 5 or 6. Children with a lazy eye where the eye doesn't turn. I think most of these children have an eye turn. You know, it's obviously picked up by the parents and the grandparents, but it is those children that don't have an eye turn, that don't have one eye that deviates, that becomes a lazy eye, but have 2 eyes that are straight, where one eye gets disuse, becomes on timeout as a result of not functioning, yet it's hidden. And so it's these kinds of cases that we need to identify early before I look at a mother who wonders why did it take the school screening at 5 or 6 years of age to determine that this condition was present. I think it's so important when we can diagnose these problems very effectively, when we can use intervention to change these things, to help normalize these systems that make what I do so important. But it's also when there's a limitation based on what we see at 5 or 6 years of age, that the limitations in that system, the fact that we cannot always normalize a lazy eye that's had 5 years to embed, that becomes the most distressing thing of trying to clinically help a parent. I guess the only thing you can do is tell them, I'm going to handle this child like mine. If we can get that vision, we will. And that aggressive nature to go as hard and core as we can to bring back that vision, even though limitations have to be discussed as well. So I hope this gives you some insights into infant vision and some insights in the fact that vision is a critical tool in the development of that child, and that early intervention, early diagnosis, early screenings, especially when it's at risk in the family, need to be done. And that the more you know, the more we protect those children.